So I'm going to play this. I'm going to play this clip. I think it's worth it. It's a couple minutes, but it kind of shows what's going on. It's Rebel News. She's got a longer video. This is Tamara Ugolini, but and on X they have like a 2-minute clip that's really just, it really does signify, it does really do the job at telling the story here.
Public Health Agency of Canada has just released its first report since it began conducting psychological operations on the Canadian public. Let's dig in.
So they've actually done a report.
Behavioral science is now the first line of defense for our health system.
We have our own applications too that nudges people and reward them for healthy behaviors or giving them badges or these kind of rewards.
The Government of Canada is a strong proponent of behavioral science as part of an interdisciplinary approach to improve the health and well-being of all.
Under the guidance of Chief Medical Officer of Health, Teresa Tam, who also serves on various World Health Organization committees, the Public Health Agency of Canada has developed a behavioral science office, and it's just released its first report on the art of how to persuade compliance with whatever they deem necessary. The report begins with a brief land acknowledgement and then aims to highlight that the Public Health Agency of Canada's, I'm going to call that PHAC, progress in establishing the Behavioral Science Office, I'll call that the BSIO, from April 2021 to March 2023. Launched in the spring of 2021, BSIO recognizes the significant role human behavior and decision-making play in achieving public health goals and improving health outcomes for Canadians. They said this wasn't easy, but the new unit provided the rapid advice and deep dive evidence needed to support the Government of Canada's pandemic response.
Governments have had to persuade their populations to accept new behaviors and conditions, all in the context of rapidly evolving evidence. As part of our transformation, we created a new unit for behavioral sciences to integrate evidence about why people make the decisions they do into our programs and policy work. The idea came from Dr. Elena Altieri. Where is Elena? She here? Can you stand up so people can see you?
I mean, can you believe this? This is Tedros saying like, our idea of behavioral science came from this lady and everybody's giving her a hand. Like what? Really? This was from a brainstorming session? You guys didn't have this planned all along? I mean, you've been doing MK Ultra experiments in the States and all this kind of stuff. And all of a sudden this lady, like, wait till you hear the end here.
In response, the idea came from Dr. Elena Altieri in response to my invitation to all staff to propose crazy ideas.
So staff propose crazy ideas. Oh, good idea, Elena, or whatever her name was.
Good crazy idea.
Let's just, brainwash. Let's nudge. Let's study the behavior science of all these people so that we get them to do what we need to for public safety.
Pub safe.
So that's that. I mean, it's basically, just to recap that, it's the first report on the psychological operations on citizens by collaborating with global organizations like the WHO. The agency wants to strengthen public health measure response, but their manipulative measures come with significant ethical concerns surrounding transparency and consent. So then, this one here, where's the other one? Actually, I think I might have been on the wrong one. Hang on a sec here.
Wah, wah.
So PHAC, that's the Public Health Agency of Canada. So it was funded by Canadian taxpayers. I haven't fact checked this, but it does look like this is a legit website that they're pulling it from. But since 2018, it's being funded by pharmaceutical companies, not to mention the direct link to the unelected foreign corporation WHO. So PHAC has zero credibility. I completely deny their authority. So this is a screenshot here from Health Canada switches to mainly pharmaceutical funding. So this is from the beginning of 2018. In October of last year, Health Canada announced it would be raising the fees it charges to drug manufacturers for new medicines introduced into the market. Historically, they've used these funds these fees to fund 50% of its operating costs in regulating prescription medication, but plans to raise this to 90% with the coming fee increase. It also plans to provide a 24% rebate if it fails to renew new drug applications within the accepted time frame. So, and then there's a highlighted box here. It says, before user fees were introduced in 1994, Health Canada was entirely funded by tax dollars. So that's an interesting change. Eh? Now it's charging fees from pharmaceutical companies. Like, that's bullshit. What, how, and wait till you see some of the programs that they have. Who knows, how much funding goes into this. But I want you to also think about it in terms of this has a real consultant feel to it. It's full of gibberish. Wait till I'll read some of it to you. Now, with the majority of its funding arising directly from the pharmaceutical industry, questions have been raised about whether or not the goal of drug companies to sell their products in vast quantities poses a conflict of interest with Health Canada. Responsibility to provide safe and effective drugs to Canadians. I mean, this is how we're captured, right? Not like the States, it's totally different. But in here, they just go right to the government and capture it. The government just opens the door. So let me just go to the report. I don't know if you even want to see this, but
I do.
It's pretty. In some ways, it's kind of underwhelming. In some ways, it's just full of gibberish. So this is the new report from April to March 2021 to 2023, behavioral science stuff. So it gets into the executive team message, building the Public Health Agency of Canada's behavioral science function through establishing an office. The first 2 years by the numbers, spotlight COVID-19 snapshot monitoring. And it's so weird because I'll wait before I start ranting about all that stuff. I don't even want to read the message. It's just disgusting from the executive thing. They're just thanking all these partners and stuff. So they have a commitment to behavioral science. Behavioral science office's origin story. What is behavioral science? I mean, we don't need to go through all that. We kind of know what this is. Behavioral science in public health. So there's an increase. This is why it smacks to me like there's some centralized consultation collaboration with this, because an increasing number of countries across the world are already using behavioral science to improve health outcomes. So this results in more informed predictions of how people will respond to programs and policies. This facilitates the identification of barriers that prevent people from acting in the interest of their health and others. It enables the design of programs and policies that align with how people tend to think, feel, and behave, and encourages evaluations of programs and interventions with an emphasis on meaningful behavioral outcomes in order to determine the best way forward. So this is the vision. This is a vision, mission, mandate. It's just a bunch of but anyways, here they get into the deep dive. There's 11 deep dive research projects, 50 plus requests for rapid advice. Ooh, 50 times. Behavioral science fellows, 10 training sessions, 10 plus, 308 community of practice members, and 63 digest newsletters and publications. So many priority public health areas addressed, including COVID, respiratory infections, public trust, antimicrobial stewardship, climate change, public health measures, mental health, childhood jabs, infectious diseases, and chronic diseases. So any thoughts so far, or?
Well, I gotta, it's not heading in a good direction.
So building a public health behavioral science practice. So this is like the timeline thing, right? They have stage 1, 2, 3, 4. We're in I guess we'd be in stage 3 right now. Achieving, contributing to the global evidence based as a mature program, or base as a mature program. And then optimizing comes next, 2025 plus, evolving and innovating practice. So here's the one about responding to the COVID pandemic. During the pandemic, we leveraged evidence from risk communications and behavioral science research to design messaging about vaccines and public health measures to support the informational needs of the public, as well as promoted the behaviors needed to keep people safe. So of course, you know what, there's no like, here, let's decide what the science is. There's nothing about that. It's all about how to change our minds of the science and the narrative that's already fixed in here. That's the way I look at it. It talks here about some Cosmos studies. I'll get into that a little bit later. The trust in government information was among the strongest predictors of Canadians' adherence to protective behaviors, willingness to vaccinate against COVID-19, and support reintroducing measures if needed. So they figure out how they figure all this stuff out. I mean, it doesn't really get into those details either. There's cognitive and behavioral factors, what people are thinking, believing, and doing have shown to be significantly more predictive of adherence to key public health behaviors than demographics alone. Their attitudes and risk perceptions related to travel and border measures were linked to and in line with public health risk mitigation evidence. So a greater belief in misinformation has been consistently and significantly associated with behavioral intentions, lower pro-vaccination attitudes, and lower self-reported adherence to protective behaviors throughout the pandemic. I mean, what do they think after all this stuff was a disaster? Like, do they think that this was all just a brilliant job that they did through COVID? I mean, it's weird.
Wow.
So I'll just finish this off here. So what does applied research look like? It does talk a bit about that. This is the impact, identify, map, prototype, act, and scale, which is all like, it's almost like the scientific method made by AI into like process management type stuff. Routine child. So here's like a spotlight. Routine childhood immunization during the pandemic. So they've got partners, challenge, project, key insights. They're just saying how much of a challenge it was to keep people vaccinating their kids during COVID. 25% of parents missed or delayed their vaccines. So, and then there's next up, the top line findings from the survey are being written up for academic publication. Spotlight antimicrobial. I'm going to just get to the bottom here. Growing behavioral science capacity. Looking ahead. Here's a quote from Teresa Tan. I certainly see behavioral science as an essential part of the future of public health. So this is any questions about that?
Isn't that she's the glory hole lady?
Yeah.
Okay. Well, I don't know. It seems like a weird thing for to fall into health, doesn't it? Behavioral science.
Yeah. Well, yeah, that's what they're saying. It's all about public health, right? How you react to this stuff, to misinformation, what do we do to keep you? It's just like, is everybody in on this, or do they just not know? They think they're doing good. Like, again, it's this creepy question of like, do they realize it? Oh, the Privy Council office is a partner too. So, any more comments about this, or should I move on?
No, move on.
So this is one of their partners, the Government of Canada, Impact Canada, right? So this is announced but see all this stuff after Trudeau, right? 2018, 2017. It's almost like they just needed a puppet in place to put all these global measures in here. This is going to be a lot of just PowerPoint buzzword type stuff. Announced in budget 2017, Impact Canada is a Government of Canada-wide effort that will help departments accelerate the adoption of innovative funding approaches. Oh, I missed that part earlier. Funding approaches to deliver meaningful results to Canadians. I could build up on this with all these other segments I have later about where all the money's going. The Impact Canada Challenge platform is a core component of the initiative. It allows Government of Canada departments to issue challenges on a common site and reach a diverse group of problem solvers and innovators. So it's just all this fluff team bullshit. They have partners. So all these massive departments are partners: Canadian Space Agency, Health Canada, Global Affairs, blah, blah, blah. All these researchers, annual reports. So I'll get to the annual report, the latest one here.
ANREP.
This is the 2022 and 2023 annual report of Impact Canada. So they talk about.
I don't
all
think
this-
I can see what you're seeing.
Oh, okay. Hang on. Yeah, thanks. You got to keep an eye on me like that when I don't share it properly. So yeah, this is the Impact Canada report from 2023. So they talk about the key findings here of this comprehensive assessment. And it's just so much fluff. Impact Canada's challenge program to fill the gap of the innovation ecosystem, rapid growth streams from 370 million to 30 active or completed outcomes, feedback from departments, Impact Canada's positive story for government, effective approaches. Like they're just puffing up their own thing, right? So here's about it. Let's just skip past that to results from our 5-year comprehensive program assessment. I'm getting to something here. Impact Canada's applied behavioral science research program. So here's where they partner with the stuff we just looked at. So this is another full-blown initiative that's connected with the other one, probably why they hired 100,000 people from Trudeau's years, because of all these boondoggles. So this is where they get into supporting the COVID response. Let's see here. I wondered if there was some stuff that I wanted to read on this. I'm just going to skip through it a bit here. Vaccine. So applied BSci to the COVID response. So they're talking about data collecting and supporting this decision making because there's longitudinal data acted as early warning signals, vaccine hesitancy before vaccines approved, misinformation, behavioral science insights on the hesitancy, mask wearing, importation of risk, directly informed policy development, program interventions and communications, increased understanding of the importance of operational transparency, advanced statistic modeling. I mean, I wonder if they were so did you guys not see that when all the provinces officially put out their jab data that it started to look really bad and they had to take them down? Did none of these programs help with the optics there at all?
Whoa. You're not that second half of show.
Okay, so here we're going into new. You want to hear the new areas, right? Of behavioral science. What's upcoming?
Yeah, I guess.
What do you think it is? What do you think it is? What do you think it is now?
Neuralink.
Climate action.
Oh.
Climate action is next. So they've already partnered with Environment and Climate Change Canada. So they're already naming the department. Here's the department name: Environment and Climate Change Canada. Thanks for setting that narrative in the name of the Canadian agency or department or whatever the fuck it is. The Parka longitudinal study talking about these collection waves, key trends from these waves, belief in climate change has remained high and stable. Oh, this might get interesting. Canadians value the repairability of home appliances. 2/3 of Canadians say they've experienced more extreme weather. Most Canadians think of carbon pricing as costing their households more than they receive in payments. Only 1/3 of Canadians trust the federal government to make good decisions on climate change. Here's some work continuing to explore and identify drivers and barriers to pro-climate behaviors. So this is where some of the stuff that you hear our politicians talk about probably come in. Improving heat pump adoption among landlords. So that's an initiative. Increasing land recognition and land donation among Canadian land trust and conservancy organizations. I don't know what that means. Reducing what?
Nobody knows what that means.
Reducing home energy costs through energy label recommendations, making it easier for Canadians to switch to electric vehicles, empowering consumers to make safer purchases for themselves and the environment, improving government communications about climate change and action, trust and misinformation, multi-wave survey examining the role and impact of trust and misinformation across policy priorities such as public health, climate action, and immigration. So it's just such a, a whole lot of just nothing. Like, why don't you try and fix some fucking problems?
Yeah.
So, I mean, I could just quickly read the conclusion here. Overall conclusions. It's not, I just don't want to read it even. Its impact is regarded as an important asset within the ecosystem that can be leveraged in a strategic manner. Like, come on. It's just such bogus. It's like a fucking AI report. Where's the meat? Where's the fixing the problems? This is just creating a whole managerial.
They're just stealing money.
They're just stealing money.
They're stealing money.